I have a pre-existing limitation, a pre-existing condition, which is cancer. I'm not insurable anymore. Nobody will pick me up unless I want to pay like incredible premiums. The way they treated me, it was get out of my face. You can't pay your bill, get out of my face kind of thing.
I played by all the rules of society, but when I was faced with this catastrophic illness and it became a business decision on their part, then the whole world changed.
You have to wait 24 consecutive months to be eligible for Medicare. I said, I don't know if I'm going to live 24 months. You made it. Close the door. Don't push me, 'cause I'm close to the edge. I'm trying not to lose my head.
Let me see them in the mirror. Let me see in the mirror. It's so hard for me to remember what my mom was like when she was not sick and could spend lots and lots and lots of time with each other. If we could go down, see the blue bonnets, and we would take pictures in there. Now that Mom's so sick, we can't really do that anymore.
My baby boy, I love you.
I like you too.
I like you too. I was diagnosed Mother's Day 2001, and at that point it was stage 2. It was a large tumor in my right breast.
At that time, I was employed on a contract basis, and we had health coverage and stuff.
He was making well over $100,000 that year. His employer sent him an email asking him to answer a questionnaire about what we were using our insurance for. So I answered it honestly, that I was undergoing chemotherapy, and he didn't get his contract renewed.
We went on Cobra. I cashed in all my retirement benefits and everything I had. We sold off all our stocks, bonds, savings accounts.
After 6 months, we had exhausted everything, and family and friends helped for a while, and I had to stop paying the Cobra. And so I had to drop out of chemotherapy and find another way to get care.
Tomorrow afternoon at noon.
My doctor told me to go to the county hospital, which I didn't qualify for. He told me to go to Medicaid. I don't qualify for that either.
And my husband.
I wasn't getting any chemotherapy, but the doctor was examining me and sending me for tests and telling me everything was okay. But then finally I got the nurse on the line, and she said, he has your results. He said to tell you you've metastasized to your lung. You have 4 lesions on your lung, and this is very, very serious, and you need to take care of it. And I said, well, what should I do? And she said, I don't know, we can't help you. You have no insurance. That's like you're driving down the street and you hit somebody. And you keep going. I mean, that's a crime. How come this doctor could drive down the street and then suddenly say, oh, you're dying, bye? My husband and I and my 2 children are facing bankruptcy and possibly losing our family unit. And to be able to stay together, it's all a direct result of my diagnosis and the way health care is provided for in this country.
We didn't have much. The only thing we had left was the house and the cars. Sheila flat refused to become destitute. She said flat out, I won't do it. I'd rather beg, and she did.
Well, today I was out on the street with the panhandling with the coffee can, and I wrote on the can, I am not a bum, I'm a mom, please help. At first it was real traumatic. It's second nature to me now. I know I need the help, and I got no other way to go but up, so I gotta allow the help to come in any way I can get it. The first day was really incredible when the New York Times article hit. And the very next morning at about 8 o'clock, the phone rang. And I got this call from a man that said, I saw your article and I am just blown away that this is happening to you. I'm an oncologist and I want you to get your medical records and bring them to me. I said, okay.
We felt there was a lot that could be done for her. We got on the phone and talked to the various drug and pharmaceutical companies. They agreed to give her free samples of the drug. We did the administration for free. We gave her our time for free. And a couple times she's had to go into the hospital. The hospital wrote off her charge.
How much would you estimate her care has cost?
Probably counting x-rays, scanning, restaging workup, lab, chemotherapy. I'm going to give you a ballpark figure in excess of $250,000.
Okay, and in your words, what is Dr. Beitsch going to do?
Remove metastatic carcinoma from my liver.
There's a tumor. We know as a general rule, early care is cheaper care, better care, and has a better survival rate. So delaying things probably puts Sheila in the place she is now.
All done, okay? Okay, just relax. He's going to get that out of there.
I can see there are signs that it's getting worse. The tumors are becoming more frequent, they're becoming larger, they're becoming, what do you want to say, more widespread.
Come on, relax. Say hi to the camera. Every now and then I feel like I think this is the beginning of the end. I feel really, really bad. I don't think I'm going to bounce back this time. And he looks at me and just says, dying is not an option. And it impresses on me, you're not leaving me here with these children, this house, and these problems, and these finances, and everything. You're staying here with me.
So scary because your heart starts beating so fast that you're about to cry because that's your only mom that you will ever have, and that you'll want to remember the times that you had with her.
That day, she said, I think I'm getting ready to die. And I said, why do you say that? What makes you think that? She says, I just feel it. And I said, when you say you're afraid, what are you afraid of? She said, I'm afraid for my children, but I'm not afraid to die. So she slept for a while. And then she got up and she had a hard time breathing again. She says, we need to go to the emergency room. She kept screaming that there were knives in her back. And I started rubbing her back. And she put her head back, staring at me. And I was holding her hand. And then she started to go.
And so, my friends, let us pray that our sacrifice may be acceptable to God, our Almighty Father.
There's got to be a way that you don't have to totally destroy everything you've tried to build up just because you get hit by some kind of a catastrophic illness. It's been 4 years since Sheila, my wife, died. And at the time she died, we were down to our last pennies. I didn't have enough money to even cremate Sheila, which she wanted to be cremated.
He is at the bottom.
I am employed now. They provide health insurance for me and the kids. Yeah, I've got debt, but a lot of the hospital bills and stuff, since Sheila had died, they just decided not to pursue it. I encouraged Sheila to take a route that she could maintain care, to sell the house. We'll liquidate everything, and we can get care that way until I can find a job, and then we can build back up. She was adamant that she didn't want to do that. I think probably to help protect the kids so they have an asset, and that's one of the reasons we're still living here. She fought for this house. Technically, she died for this house. The kids get Social Security death benefits now, and I don't understand that. To wait until the mother's dead? Why couldn't Sheila get benefits? I didn't have to sell anything for Social Security. It just was there. And that's the way healthcare should be. If we have a society that's very strong and rich, and people that have all this stuff think that, well, it won't happen. And then the trouble is that it can happen. And it did happen to me and Sheila. And it cost us dearly.